Okay, it's another fine day that I'd like us to look at acidosis. So we just want to know what exactly is acidosis and a number of issues around acidosis. But before we go into details of acidosis, it is important to know that we have excretory organs in the body whose function is actually to eliminate or remove waste products from the body. So the body undergoes a lot of metabolic activities, and in that process, there is a lot of waste products which are normally formed as a result of daily metabolic activities that take place in our bodies. So here we have a number of excretory organs that are found in the body, and we have the skin. The skin excretes a waste product known as sweat, and in this sweat we have things like water. We have water. So sweat, we normally have just water and some, just say some salts. So those are some of the waste products that are excreted using the skin. We also have the liver, and its function is actually to excrete bile, bilirubin, and even urea, among other waste products. How about the kidney? The kidney excretes urine, and it is in this urine that you can also get water. So urine has water, it also has urea, it also has excess salts, among other waste products. Lungs is also another excretory organ in the body, and the waste product that it excretes is actually CO2, which is just carbon dioxide. Then we have the large intestines, and their function is to excrete some waste products. Those are just the solid waste products after digestion as a result of having taken food. So having mentioned a number of excretory organs in the body, now we want to look at acidosis. And in acidosis, the excretory organs in question mostly is actually the lungs and also the kidneys, sometimes also the large intestines. So, what is the definition of acidosis? So this is a condition in which there is too much acid in the body, and that is the opposite of alkalosis, which means there is the issue of acid, And there's the issue of alkaline. Alkaline is just a base. Here, the main culprit is actually the hydrogen ions, while here the main culprit is actually the bicarbonate ions. Bicarbonate ions. Bicarbonate ions. So, in acidosis, there is accumulation of acid in the body. And acidosis is the opposite of alkalosis. And what you need to know is that there is something known as the pH scale, the pH. The pH scale, we have numbers from 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. So 7 here is the point of neutrality. So this point we call it neutral. And what is the normal pH of the body? The normal pH of the body is 7.4 plus or minus 0.05. So when we talk of 7.4 plus or minus 0.05 in simple terms, we simply mean it is a range 7.35 all the way to 7.45. So it's a range. This is the normal pH of the body. Meaning anything below this is just acidosis, is what we call acidosis. Anything below 7.5. If your pH falls below 7.5, then we shall be heading towards acidosis. And if your pH goes beyond 7.45, we will be heading towards alkalosis. That is why in this definition, acidosis is understood to be the opposite of alkalosis. And it's all about the changes in the pH of the body, whereby we are saying the normal pH is a range. The normal pH of the body is a range between 7.35 to 7.45. That is in simple terms, which is just the same as 7.4 plus or minus 0.05. And anything below this is acidosis. Anything above that is actually alkalosis. So we have seen the pH scale, we have seen the definition of acidosis, and the pH scale is something like this. So the neutral point is actually 7, and from this side you will be moving towards acidosis, while from this point towards this side you will be moving towards alkalosis. So that is a pH scale. Now, let's talk about the types of types of acidosis, and the possible causes of acidosis, and maybe the management of acidosis. There are two types of acidosis. So we are talking about the types of acidosis, and we are saying there are two types. One is known as metabolic acidosis, and then the second one is normally known as respiratory acidosis. So there are two types of acidosis. We have metabolic acidosis, and there is also respiratory acidosis. But before we go into those details, it is important that we get to understand how does acidosis come about. The basic concept of acids is that when you dissolve a gas into water, then you can get an acid. Basic concept. Therefore, if I take my CO2, which is carbon dioxide, and I'm adding water, then I'm supposed to get this. And this is a weak carbonic acid. Weak carbonic acid. And this is water, while this is a carbon dioxide, just CO2. When you add carbon dioxide into water, you'll get a weak carbonic acid. And this carbonic acid, as the name goes, weak, it can dissociate into hydrogen ions plus bicarbonate, sorry, this is just H, plus bicarbonate ions. So it's a weak carbonic acid. It can dissociate into hydrogen ions and bicarbonate ions. And accumulation of hydrogen ions is what leads to acidity. And there is a very special enzyme that works in this reaction. It's called carbonic anhydrase. This is an enzyme that is very important when it comes to this reaction. So, for example, when we are talking about respiratory acidosis, this is where a patient has a problem in respiration. There is a problem in respiration. For example, this patient has what we call COPD. COPD means chronic obstructive pulmonary disease. When you have COPD, that is chronic obstructive pulmonary disease, then it means ventilation is obstructed. Your ventilation is obstructed. And when we talk of ventilation, we are just talking about movement of air. Movement of air in and out in and out of the lungs. In and out of the lungs. And the air here, we are interested in oxygen and CO2. CO2. These are the only vital gases that we are interested in when it comes to matters of respiration. So you are supposed to breathe in oxygen and breathe out CO2. So when there is obstruction in your airways, then it means the whole process of movement of these gases is obstructed. So when there is obstruction, it means the body will not get oxygen. That is number one. The body will not get oxygen. And then number two, it will be difficult to excrete CO2. So the outcome of obstruction, you can call it obstruction outcomes, and this is just airways, airways obstruction outcomes. One, your tissues will have deprived, there will be reduced oxygen intake. Then number two, there will be reduced CO2 removal. So if there is reduced CO2 removal, then it means your CO2 is actually accumulating. It is accumulating in the circulation. When your CO2 accumulates in the circulation, it will just dissolve in water to give you the weak carbonic acid. And it is this acid that will now change the pH of blood. From the normal range, which is 7.4 plus or minus 0.05 to less than that. So your blood will become acidic. And what is the effects of the body becoming acidic? There is this issue of enzymatic reactions. Remember, in the body, human beings have approximately 75,000 enzymes, just approximately 75,000 enzymes, which carry out metabolic activities in the body, metabolic reactions. And what you need to know is that we have factors which affect enzymatic reactions. One of these factors is pH. Another factor is temperature. Another factor is substrate concentration. Another factor can be even enzyme concentration. So we are talking of inhibitory and also activators of enzymatic reactions. So we are concerned with pH. When you change the pH of the body from the normal range of 7.35 to 7.45. If we make it more acidic, we have enzymes that will not tolerate this pH in the body. And therefore, they will be denatured, and their enzymatic activity will be stopped. And when the enzymatic activities are stopped, then your body will just undergo some pathologies depending on which enzymes are affected. Remember, enzymes are just proteins, and proteins can be denatured when subjected to extreme pH and even temperature. That is the reason why the human body must have a constant range of pH. That is the reason why whenever there is any change in pH, whether there is acidosis or alkalosis, it becomes a medical issue. So, in metabolic acidosis, this one occurs when the body produces too much acid. Kidneys cannot remove enough acid, or the body loses too much base bicarbonate. Remember, when we were introducing the topic, we talked about bicarbonates, and hydrogen ions. So pH changes, which is acidosis and alkalosis, just depends on these two ions. When there is too much hydrogens, then we are talking of acidosis. And when there is too much bicarbonates ions, then it gives you alkalosis. So what happens is that, remember we said there are two types of acidosis, and we said we have respiratory acidosis and metabolic acidosis. So this is one and this is two. But under respiratory acidosis, we have subtypes, and under metabolic acidosis, we also have subtypes. So the subtypes, if we can start with metabolic acidosis, the subtypes under metabolic acidosis, we can have DKA, and then we can also have lactic acidosis, and then we can also have what we are referring to as renal tubular acidosis. We can also have this one here, which is hyperchloremic acidosis. Then lastly, we can have ingestion stroke poisoning acidosis. DKA, this one is very common, and this one is a result of lack or reduced insulin, and therefore it means there is very limited uptake of glucose into tissues. Yeah, let me just delete this one so that we can talk something about DKA. When we talk of DKA, we are just talking of accumulation of ketones in the blood. And how does accumulation of ketones come about in DKA? DKA, number one, it is one of the acute complications of diabetes. So how does the scenario happen? There is this hormone called insulin. And the function of insulin is to enhance glucose uptake into the tissues. So it means when you take food, your glucose will go into circulation. That is in the blood system. So for this glucose to leave circulation and go into tissues, you need insulin, this one here. So it is the insulin that extracts glucose from circulation into tissues. So in diabetes, there's a problem in insulin. It is either this patient has no insulin, or it is insufficient, or it is non-responsive, depending on the type of diabetes. For example, in type 1, there is lack of insulin, but in type 2, there is insulin which is non-responsive to receptors. So what normally happens is that when you don't have insulin, or it is non-responsive, then it means the process of extracting glucose from circulation into tissues will not take place. And that's why we end up having accumulation of glucose into blood. And that's why when we do a test called RBS, which is just random blood sugar, you find that your sugars are high. Because they are accumulating in the circulation instead of getting into the tissues where it is supposed to function. Remember, it is in the tissues where your glucose is supposed to be utilized. It is in the tissues where your glucose is supposed to be utilized by the cells so as to produce energy. So in DKA, there is issue with insulin, so there is accumulation of glucose into circulation. So what normally happens is that since now the cells and tissues are undergoing starvation, because there is no glucose, because glucose has not been extracted from circulation, therefore the tissues are undergoing starvation. So these tissues are supposed to produce energy from glucose. But glucose is not there in the tissues. It's not reaching the tissues because of issues in insulin. So what is supposed to be done by the tissues? The tissues now go to what we call alternative methods of producing energy, because your cells actually need energy in form of ATP for them to actually function properly. One of the alternative methods here is now metabolism of fats. Since there is no glucose in the tissues because of a problem in insulin, then the tissues undergo starvation, and then they choose an alternative method of producing energy, and that is metabolism of fats. And the problem with metabolism of fats is that Too much fat, too much fatty acids are usually burned and they produce very little energy in the form of ATP and produce a lot of ketones. They produce a lot of ketones. So the fatty acids are not as efficient as glucose when it comes to production of energy. But because the tissues have been deprived of glucose due to issues in insulin, the tissues now have no other ways rather than going to these routes of fatty acid production to see if, actually fatty acid metabolism, to see if it can now produce some energy for it to survive. So it burns too much fatty acids and the energy produced is very little. And in the process of burning these fatty acids, ketones are produced. These ketones are the ones that accumulate in the body and change the acid of, actually they change the pH of the circulation. So the ketones from metabolism of fats, ketones, they will get in the blood and they will change the pH. So the pH will go down. So that is what happens in diabetes ketoacidosis. So we call it diabetic ketoacidosis. Acidosis. So diabetic from diabetes, and then ketones from fatty acids, and then acidosis because of change of pH due to these ketones. So that is the simple pathophysiology of DKA. So when there is fatty acids, the ketones from fatty acids, they will change the pH. So the pH of blood will shift towards acidosis. And that is why it's referred to as metabolic acidosis. So DKA is one of the examples of metabolic acidosis. Lactic acidosis is also another form of metabolic acidosis. And what happens in lactic acidosis is that there is no oxygen. There is low oxygen. In the process of production of energy, we call it glycolysis. And there's also the issue of ETC, electron transfer process. So what happens is, in lactic acidosis, these people are having an extraneous activity. For example, you are running, or you are just playing football. So here, there is too much accumulation of lactic acidosis because of anaerobic respiration. In anaerobic respiration, there is reduced oxygen. Remember, oxygen enables breakdown of glucose into energy, and this energy is always in form of ATP. That is adenotriphosphate. That is ATP, adenotriphosphate. So the energy is in form of adenotriphosphate. Oxygen helps in conversion of glucose to produce ATP. When there is no oxygen, the type of respiration in the tissues will be anaerobic respiration, and therefore this glucose will be converted into lactate. And this lactate is now which is acidic, and it will change the pH of blood. So that is what happens in lactic acidosis. Another example of metabolic acidosis is actually renal tubular acidosis. This one is the issue to do with the kidneys. So the kidneys, when they fail, there's something called CKD. This is just chronic kidney disease. In chronic kidney disease, as you can see here, there will be a problem with filtering. There will be a problem with filtering of acid. Remember, we said kidney is one of the excretory organs. And it's supposed to filter the urine together with these substances called acids from the body. So when you have CKD, which is chronic kidney disease, it means your kidneys are failing. They have failed. When there is kidney failure, then there will be accumulation of this kind of acids, and therefore we'll just get acidosis. So those are just some of the explanations to some of those types of metabolic acidosis. So we have 5 of them, as you can see. These other ones, for example, hyperchloremic, it is due to loss of sodium bicarbonate. Remember, bicarbonates are the ones that are supposed to balance. When there is too much acid in the body, when you add bicarbonates, it reduces acidity towards alkaline. So when there is this problem here, then it means there is a lot of loss. There's a lot of loss of bicarbonate, and this loss can be due to diarrhea. So when you have diarrhea through the large intestines, remember we also said the large intestines are also part of the excretory organs. When there is diarrhea, you lose a lot of bicarbonate, and therefore you get just acidosis. Remember, acidosis and alkalosis just revolves around 2 things. This is hydrogen ions, which is 1, and 2 is bicarbonate ions. So when you reduce bicarbonates in the body, your body becomes acidotic because of accumulation of hydrogens. So it is hydrogen ions and bicarbonate ions that balance each other so that you get an equilibrium pH of 7.4 plus or minus 0.05. So whenever there is accumulation of hydrogens, then you get acidosis. Whenever there is accumulation of bicarbonates, you get alkalosis. If there is loss of bicarbonates, which means what is remaining is hydrogens, then you get acidosis. And that kind of acidosis is what is known as hypercholoremic acidosis, and one of the causes is diarrhea. Then we have also the issue of ingestion and poisoning. When you take substances like antifreezers or even alcohol, too much alcohol also can change the pH of the body, and then you can also get acidosis. So those are just types of metabolic acidosis. How about respiratory acidosis? This one we had talked about it initially. we said that there is obstruction in flow of air. We actually call it airway obstruction. And the good example of airway obstruction is COPD. This is accumulation of conditions. This is a group of conditions. One can be asthma. Others is issues to do with chronic bronchitis. Bronchitis can also be part of this, and so on and so forth. So when there's obstruction in airway pathway, we say air is actually obstructed. And the air that we are, in this air, the gases that we are concerned with are just two. One is oxygen, and the second one is CO2. So meaning there will be reduced entry of oxygen, and there will be accumulation of CO2. And remember we said CO2 plus water, you get weak carbonic acid. It is this weak carbonic acid that changes the pH of the body, which means it makes it more acidic, and therefore you get acidosis. So that is what normally happens in respiratory acidosis. Anything that can cause obstruction in the airway will give you respiratory acidosis. A good example is neuromuscular disorders. For example, if you have a condition that can weaken the muscles which are supposed to help you in breathing, then it means your breathing will be distorted, and therefore you will not be able to do the intake and excretion of CO2. And a good example of this kind of paralysis is Guillain-Barré syndrome, GPS. So remember, the muscles are supposed to help you to breathe, and that breathing is what we call ventilation, to ventilate. As you ventilate, you are bringing in oxygen and you are taking out CO2. If the muscles that are supposed to do that work are paralyzed, then you will not be able to do that, meaning there will be reduced entry of oxygen and there will be accumulation of CO2, and therefore you just get respiratory acidosis. Other things are just airway obstruction, also central nervous system suppression. For example, a drug like opioid. In central nervous system suppression, then we can also mention something. It's important to know that the respiratory rate is actually an involuntary activity. And all involuntary activities in the body are controlled by what we refer to as the autonomic nervous system. In this case, we are just talking about two divisions. One is the sympathetic activity, and the second one is just the parasympathetic activity, So, your brain is supposed to regulate the respiration rate through autonomic nervous system, what we call the ANS, is on here. So if I give you medications that will paralyze your ANS, that is autonomic nervous system, ANS. If I give you a drug like opiates or sedatives to sedate your CNS, and these drugs can be opiates like morphine. Morphine is a good example. or I just sedate you, maybe using diazepam, then it means I am actually slowing the functions of the brain in terms of regulation of respiration using autonomic nervous system. Then it means the respiration rate will go down. It will go down. And when your respiration goes down, the respiratory rate goes down, it means there will be accumulation of CO2. There will be accumulation of CO2. When there is accumulation of CO2, you will just get acidosis. You will just get acidosis. And the type of acidosis in this case is respiratory acidosis. Respiratory acidosis. And that's why when patients are sedated, their respiration goes down, and sometimes it's important to put them on supplement oxygen. We call it supplement oxygen. Supplement oxygen so that you can enhance continuous respiration, because this patient's respiratory rate has gone down because of paralysis of the brain center that are supposed to regulate respiration. So that is why central nervous system suppression can also give you respiratory acidosis. This is just an equation that we have talked about. The equation that is involved in balancing the pH of the body. We call it buffering system of the body. And it revolves around just CO2, bicarbonate ions, and hydrogen ions, as well as water. So you can see there is carbon dioxide there, which is CO2, and is being added to water. And this reaction is supposed to give you this. And this reaction is reversible. It can go either way. So we use two arrows. So it's supposed to give you what we call the weak carbonic acid. So this weak carbonic acid is also a reaction, can also react or dissociate to give you those two things, and that is hydrogen plus what we refer to as bicarbonate ions, these ones here. And it is from this hydrogen that we get the issue of acidosis, and it's from these bicarbonates that we get the issue of alkalosis. So accumulation of hydrogens will just, this hydrogen, that's why they call it, this hydrogen, accumulation of it will give you acidosis, and the accumulation of bicarbonate will give you alkalosis. So, and we said this reaction is usually maintained by an enzyme, we call it carbonic anhydrase. So whenever there is accumulation of ions, or when the patient is in acidotic state, then the body will try to compensate by increasing the level of bicarbonates so that to merge the issue of hydrogen ions. And the opposite is true. If the patient is in alkalosis state, it means he has high or increased bicarbonate ions, and therefore to bring it to equilibrium, you need to increase the level of hydrogen ions. So here is the lungs. In the lungs, this is the oxygen, not oxygen really, this is CO2. When CO2 is added to water, that is in the lungs now. After intake in the lungs, not really. When there is CO2 in the circulation, it will mix with water, and it will give you the carbonic acid, The carbonic acid will give you these hydrogen ions and bicarbonate ions. And you can see we have two respiratory organs here. We have the lungs here, and we have the kidneys here. So these are the two organs that are central to the regulation of pH of the body, which means if there is acidosis, then it means there is accumulation of CO2, therefore will increase respiration. The rate of respiration is supposed to increase respiration. And this respiration now comes to what we call the brain, which is now the regulator. So the brain will stimulate respiratory system to increase respiration so as to remove the excess CO2 that has accumulated in the body. The same thing to the kidneys. When there is alkalosis, then the kidneys are supposed to increase excretion of bicarbonates to balance. So the lungs will increase respiration to remove CO2 in cases of acidosis, while the kidneys will increase the rate of removal of bicarbonates in case of alkalosis. So that is how the two organs, the two excreted organs plays around to try and get the standard pH, the equilibrium pH, equilibrium. So the pH of the body is supposed to be normal range, within the normal range, that is 7.35 to 7.45. So whenever there is a shift towards the acidic side, then respiration increases to try and remove excessive CO2 from circulation. That is why when you get a patient with DKA, these patients will have deep breathing, to try just to remove excess CO2 in circulation. So all patients who have acidosis, they'll come with increased respiration. And the reason is that the body is trying to compensate by trying to increase the rate so that it removes excess CO2 in the circulation. So the two organs in the center of regulation of pH is lungs and the kidneys. That is in the body, to make sure that the pH always falls into the equilibrium. So the moment the two organs fails to balance this equilibrium pH, then that is now the time the patient now develops difficult complications, and that is when now they come to hospital, because the body's mechanism to balance the pH has been overwhelmed. So these organs, the kidneys and the lungs, try as much as possible to balance the body pH, and if there is excess such that they cannot balance, then the patient becomes deceased. And that is when now the patient comes to hospital. So that is just some basics on how the body tries to balance the pH to get it into normal ranges. And now how do we manage metabolic acidosis? Number one is to identify the cause. Once you have identified the cause, you manage the cause together with conservative management. Conservative management, one is oxygen. Two is airway. If there's issues with airways, you have to balance it. You can also talk of IV fluids, just to wash out accumulated ketones. This is, for example, when you are dealing with the DKA. So one of the strategies is to use sodium bicarbonate, which is used to balance the blood acid levels. That is for kidney failure or chronic acidosis, through sometimes delivered via IV. But these are the drugs that are supposed to be given with maximum care in established facilities where we have qualified personnel to weigh options in terms of risks versus benefits, as well as accuracy in terms of administration of those drugs. If it is DKA, you also do the issue of insulin and fluids you administer to just control ketoacidosis. There is dietary adjustments. In kidney failure, you do dialysis, and you can also use specific agents in terms of the type and the causative agent of that state of acidosis, as we have seen. If the patient is having respiratory acidosis, what is the management? One, make sure that the airways are well established. You can do bronchodilators. Two, you can enhance breathing support. That is ventilation. That we have already talked about. It was very common in COVID-19 cases. Remember, COVID-19 infections actually interfere with breathing with maximum or actually severe inflammation of the lungs. That is why ventilation, supportive ventilation comes in. So in other cases, you can do medication adjustments, meaning if the patient was on sedatives, then you just reverse. You reverse sedation. That is why we say reversing sedatives or substances that are slowing breathing. So, in summary, we just said acidosis is just accumulation of acidic state in the body. And then we also said that the normal pH of the body is 7.35 to 7.45. And then we said the types of acidosis are 2 and 1. That is the types of acidosis. There are 2. We said 1 is metabolic acidosis. And a good example here is DKA or lactic acidosis. The second type of acidosis we said is known as respiratory acidosis. A good example is due to COPD, which is chronic obstructive pulmonary diseases. And we said, this is 4, there's my duster. Another thing that we said is that acidosis plays around just about the issue of hydrogen ions and bicarbonate ions, whereby the issue of excessive hydrogen ions will give you acidosis, while the accumulation of bicarbonates will give you alkalosis. And we said The organs that play a role in balancing pH, the body pH balancing. The two organs that are involved is actually the lungs and actually the kidneys, whereby the lungs play a role in excretion of CO2, that's in case of acidosis, while the kidneys will function to reduce bicarbonates, to balance bicarbonates. That's in terms of alkalosis. And then we also said that management of acidosis will just address the cause. You address the cause of acidosis. You address the cause of acidosis, and then you can do also conservative management. And in conservative management, we are talking of things like IV fluids, depending on the type of acidosis that you are handling,